You're here for some laser treatments, and briefly tell me how many years you've been having pain problems.
Oh, the neck pain for probably 5 years. They did x-rays and showed degenerative changes and so forth.
Everything else?
The back pain I've had for probably 5 or 6 years, but it wasn't constant until the last year. Last year it's been constant, it's been debilitating, and I can't.
Okay. And so we haven't treated the neck yet.
No.
We are still doing, we have started treating your low back area, and we have given you some injection treatments. And it went away for some while, and it's come back before the 6 weeks period is over. So you're still having you're better, but still having some pain, and the neck still remains to be treated. So I thought we will go ahead and do some laser treatments, because if we go and put steroid based injections everywhere, then the total amount of steroid medications will exceed, and it will do more harm than good. And also your pain symptoms will come back less than before the 6 week period is over. So we cannot keep on putting these injections over and over again. Okay, so why don't you get up? Let's see what's hurting. Okay, so getting up from the chair is a problem.
It's easier. It's hard, but it's easier than it was.
Than it was. Okay. All right, turn around. Okay, so does that hurt there? Right in this?
I sort of have to right in there.
Okay. What about?
And then right here.
So what about here, right in this middle part here?
Yeah, that's sore too.
That's sore too. And then these are rib projection areas.
The rib is on the left where I had all the rib fractures.
So you had rib fractures here.
And underneath the scapula on the left.
Okay, so these areas are hurting?
Yes.
And pressing?
Yes.
Okay, all right. And how about here? That
yes, it's worse on the right, but both of those are
both of them are
sore.
Okay. And
hurt
here. Okay. Now the hip joints kind of became better after the injection treatment. So we're not going to treat that. Not only that, we don't have longer needles, so that's another reason we can't do the hip joints. But all the other joints we're going to do today, and see how you feel when you get back here, and we'll do the same clinical exam and get your input. Okay, good. Eloise, you just now had the laser treatments.
Yes.
How do you feel?
I feel much better. The low back feels good.
Feels good.
And
Okay.
I can stand erect, which I haven't been able to do for a long time.
Okay.
And the neck feels good, and the shoulder feels good, and just I'm praying this will last.
Okay. Why don't you stand up? Let's see how you. Okay, so you're not able to.
Pop
you
right
didn't
up.
even touch there, and
No,
you
I
just
didn't,
got up.
I didn't have to have the support.
Good, good. Why don't you stand up?
I'm in doctor's
Okay, so you're able to stand without holding. I mean, get up from the chair. So we cannot keep on putting these injections over and over again. Okay, so why don't you get up? Let's see what's hurting. Okay, so getting up from the chair is a problem.
It's easier. It's hard, but it's easier than it was.
Okay, why don't you stand up? Let's see how you. Okay, so you're not able to.
Pop
you
right
didn't
up.
even touch there, and
No,
you
I
just
didn't,
got up.
I didn't have to have the support.
Good, good. Why don't you stand up?
I'm in doctor's
Okay, so you're able to stand without holding. I mean, get up from the chair.